Welcome to Chapter 7, Principles of Pathophysiology. What we're going to talk about is how the disease process functions within the body. Understanding how it functions will help us understand the symptoms that are displayed externally for our patients, and also how our treatments work internally with the patients. It's very important that we pay attention to how the body works so that we can help our patients get better. Start out with one of the smallest building blocks of the body, the cell. This is where that coloring book comes in handy because you can actually, every cell has a membrane on the outside that gives it protection and form and shape. It has ports on it that will allow water and other substances in and out based on what kind of structure these substances have. Inside the cell, one of the most important features that we're going to run into is the mitochondria. The mitochondria takes the glucose and other nutrients that are brought into the cell from the bloodstream and convert those to ATP, adenosine triphosphate. ATP is the fuel that we send to the rest of the body to use by the other cells to create life. So ATP is very vital to how our body functions. All right, here's a picture of the cell. The important parts we're going to need to remember: the nucleus. The nucleus helps us, contains all the DNA, all the instructions for how the cell is supposed to work. The mitochondria, these are the power plants of the cell. They take the glucose and the oxygen and use that to create the ATP. So those are your two main parts of the cell. And then, well, of course, we've got the cell membrane around the outside here. You can see sometimes we have the little ports for the different substances to get in. If you take the more advanced A&P classes like at UCCS, you're going to run into all these names. But for our purposes, mitochondria, nucleus, and cell membrane are the three main parts you need to know. Water gets in and out of the cell. If you got too much water, it blows up. It actually expands out too big, and if it dehydrates or too little water, it dehydrates and dies. So that's why we want to keep a nice good balance. Also water helps us maintain our electrolyte balances. So sodium goes in and out of the cells and water follows it. Glucose is that basic energy block. The problem with glucose is it cannot enter a cell unless it has a passcode, and that comes from the insulin. The insulin hooks up with the glucose and helps it get through the cellular membrane into the cell. So that's why if a patient doesn't have enough glucose, then we're going to have, or excuse me, enough insulin, then they're going to have issues getting the glucose into the cellular level, and they will have high blood glucose in their bloodstream because it's not getting the cells. Two types of metabolism in the body. We have anaerobic metabolism and aerobic metabolism. Aerobic is the normal function of the cell. It's when the oxygen comes in, it's combined with the glucose in the mitochondria and produces ATP. If for some reason you don't have enough oxygen, or the blood cells aren't delivering enough oxygen, your mitochondria still attacks the glucose and tries to convert that to energy. It creates a little bit of energy, but because it's not a good combustion, it's going to have byproducts. It's going to have lactic acid being produced, and that increases your acid content of your bloodstream and makes it really difficult for the heart to function. So it's kind of like a fireplace that's not working right. If you burn wood in it and the wood isn't completely burned, you get carbon monoxide, which is bad for your body. So think of it like that. The mitochondria just puts off a byproduct that gets your body all jammed up. So here's kind of like what's going on here. You've got the capillaries where you have that gas exchange, the cellular respiration. Glucose and oxygen drop off of the red blood cells go through the cell membrane into the mitochondria. Normal operation, you have CO2 as a byproduct. It goes back into the bloodstream. The ATP goes in the bloodstream and circulates through the body to the cells. And then you have water byproduct. That's a normal cellular function. When you're not getting enough oxygen, the glucose goes in, the mitochondria converts it, very little ATP, so the person's not going to have the energy they're supposed to, and it's going to create the pyruvic acid, which turns into lactic acid, and then you will get lactic acidosis. One thing that they are trying in some trauma centers, and they've considered using it pre-hospital, is testing people for lactic acid in trauma settings. And that will tell you how much anaerobic metabolism is being done within their body. It's something they've been doing with Olympic athletes for years now, testing them after their workouts to see if they have any lactic acid, and that shows how efficient their body's working. Many diseases go in through the membrane. COVID actually will get into the cellular membrane and affect the DNA in this nucleus. So that's one of the diseases we're kind of pretty familiar with right now. Sometimes the membranes work and keep them out. Sometimes they hide, and sometimes they just block the ports on the membrane. So kind of depends on what the disease process is and how it's going to affect the cell. So what we want to do is maintain homeostasis. Homeostasis is the happy place for the body. Everything works normal. The brain sends out signals that make sure your pulse is between 60 and 100. Your respiration is between 12 and 18 or 12 and 20. Keep everything nice and even. So the key structures, the hypothalamus and the medulla oblongata. Those are the ones that send out the hormones that keep everything nice and normal for us. We have the fight or flight response. This is part of the central nervous system, autonomic nervous system. The parasympathetic, or feed and breed, everything's kind of chilled out. You're doing good digestion. Reproduction systems are working normal. Heart rate's calm. Blood pressure is in the normal to low range. That's the parasympathetic. I try to remember that by saying paramedics are lazy. The feed and breed, so they keep it nice and chill. Sympathetic nervous system, that's your fight or flight. That's when you get all excited, your body dumps some epinephrine and norepinephrine in. It increases your heart rate, increases your blood pressure, dilates your pupils, gets your muscles twitchy, gets your brain functioning hard, really sharp, and then also starts to decrease your digestive system to free up that blood flow to other parts of the body. So you're going to be nauseated, you're going to be all wound up, and your heart's going to be going fast. So that's a sympathetic nervous system. Cardiovascular or cardiopulmonary system is the next one we're going to talk about here. You got the respiratory and cardiac systems together. They kind of function together because you can't have one without the other. They bring the oxygen in, circulate it through the body, drops the oxygen off, picks up the waste products, and brings it out. Any problems with that system is bad. That's typically what everybody dies from eventually, is a failure of the cardiopulmonary system. Key components, we've talked a little bit about this. This is a bronchial tree. You see you come through the larynx down the trachea. It branches off in the right and main bronchus. The right main stem is kind of a straight shot, and the left goes a little bit crooked. That's because the heart sits right up underneath the left main stem. So that kind of goes around the top of the heart and into the lung tissue. Down at the end of the pathway for the lungs, you've got the alveoli sacs. These are little fibrous sacs that expand and contract with the air going in and out. They've got a really thin membrane. They're completely surrounded by capillaries. And as the air goes in, the oxygen transfers through that membrane into the bloodstream, and the carbon dioxide drops off and goes into the alveoli, and it's exhaled. So that's how the system works. And when those have malfunctions, that's when we have issues with the respiratory. Most important thing in every patient is going to be your airway. Any type of obstruction is going to start causing problems. So we want to make sure that the patient is breathing and the air is going in and out. If they don't have an open airway, spend all your time fixing that until it's fixed, because it really doesn't matter if you do something to stop the bleeding if they're not getting oxygen into their system. So we need to look for foreign objects, infections, trauma, anything in there that's going to cause us problem. The lower part of the airway, this is where we're going to have that gas exchange. So we got to figure out how much air is going in and out to make sure they've got enough to get a good gas exchange. We're going to call the volume of air going in and out every time tidal volume. That's how much air goes in and out in one breath. It varies based on how hard you're breathing, how much oxygen you're needing, but we take that tidal volume times the rate, and we get what we're calling the minute volume. How much air goes in and out in 1 minute. This is going to help us understand the differences between respiratory distress, respiratory failure, and difficulty breathing. If we change the volume or rate because they're multiplied by each other, you change the minute volume. So if my volume goes down, my body tries to fix it by breathing faster. So if I'm breathing 10 units 30 times a minute, but I start taking deeper breaths, I do 20 units, and I breathe 15 times a minute, I'm breathing the same tidal volume or minute volume. Hopefully I did that math right. So anytime those things change, we're going to have issues, but the body's going to try to compensate and maintain that one number because the body likes homeostasis. Respiratory function dysfunction comes from many areas. Let's start talking about the brain level. If we have some type of damage to the medulla oblongata, we can have difficulty breathing. The medulla oblongata sits in the very lower portion of the brain, so if you have any swelling, it puts pressure on it and causes problem. We also have issues with drugs, toxins, infections. People that have some type of inflamed brain, uh, like West Nile or St. Louis encephalitis. You can have drugs such as your opioids that cause difficulty breathing or slowing of the respiratory rate. Disruption of the pressure. Normal breathing is because we have a difference of pressure when you inhale and exhale. So you change the size of the chest, it changes the internal pressure and either goes in and out. If some reason we create a hole in the chest wall, when you change that pressure, air goes in the path of least resistance, so it starts going in to the chest cavity but not into the lungs. As that air accumulates around the lung tissue, it doesn't do the gas exchange, it just takes up space. So that creates a decreased tidal volume, which does increase or decreases our ability to provide good minute volume. Or we have some type of problem with the alveoli. It could be a chronic condition like emphysema or bronchitis. Could be an acute problem like some type of gas that gets in there. You get anhydrous ammonia. When it gets into the lungs and gets reacting with the water tissue in the lungs, it actually starts forming hydrochloric acid. That burns the alveoli and causes problems for us. So we want to keep that lung tissue healthy. So if you have problems with the lung tissue, with the chest mechanical side, or you have problems with the brain sending the right signals, you're going to have some type of respiratory dysfunction. Knowing what the problem is helps us understand how the body's trying to compensate for it. If I can't take a deep breath, I breathe faster. If you've ever had a broken rib, you know you can't take a really deep breath, so you breathe faster to try to compensate. So you maintain that minute volume because your tidal volume's decreased, so you have to increase your rate. The reason we take a breath is because the chemoreceptors in our bloodstreams are detecting oxygen and carbon dioxide. Typically, the chemoreceptor that we get our primary signals from is our carbon dioxide level. We exhale because we have carbon dioxide in our blood. The body knows it's picked up some blood from the cells from metabolism. It needs to get rid of it, so it tells you to take a breath. People that have damaged those that have chronic high levels of carbon dioxide, people that smoke, chronic obstructive pulmonary disease, emphysema, other diseases, they've damaged that carbon dioxide chemoreceptor, so they go to the oxygen receptor. We've got a backup system. If you have a low oxygen, you take a breath. There have been some concerns in the past that if you give a patient oxygen and they're using their oxygen chemoreceptors, that they may not take a breath because they think they have enough oxygen. That's not the case. It doesn't happen that quick. Maybe 24 to 48 hours of oxygen, and using the chemoreceptors for the oxygen, you might have a problem, but we're not going to have our patients that long, hopefully. On to the blood, the pathophysiology of blood here. So you get your four main parts: the plasma, the red blood cells, the white blood cells, and the platelets. Each one has specific purposes and what they do. One thing that we need to think about as far as the pathophysiology is the plasma onconic pressure. There are large proteins in the bloodstream that attract the water into the bloodstream and keep it full, because we want to have volume in there. We want the plasma to keep everything full, so we have that protein in there that attracts the water in, pulls it out of the cells. Sometimes we've got to push that water back into the cells, so we've got to change the way the body functions for a little bit. We typically do that with IV fluids. We give them a little bit extra fluid, and it realizes it can release the fluid that's there into the blood, into the cells, so we can help that dehydration issue. Some other dysfunctions we're going to have. If you have bleeding, you don't have enough blood to circulate the oxygen or the carbon dioxide around. If you have dehydration, the blood gets too thick because there's not enough plasma in it. Anemia is when the red blood cells don't pick up the oxygen like they should because they don't have enough iron in them. And then you've also got liver failure. Liver is the filter that cleans the blood up after it goes through. If you don't have a good liver, you don't have that cleaning process, and you have all the extra byproducts floating around in the blood. Here's kind of a capillary view of the cells. You see the arteries are coming in, jumps over the capillaries. As we go through the capillaries, you have the gas exchange, and then the deoxygenated blood rich in carbon dioxide goes back in the veins and goes into the bloodstream. The blood vessels are a key component of the cardiorespiratory system. They take the blood around the body, start from the heart, go to the lungs back to the heart, and then the rest of the body and back. So it moves everything around. Capillaries are where all the gas exchange happens. You have to have good pressure to push the blood around. If you don't have enough pressure, your body will compensate and shut down the exterior pressure points. So it's going to say, I don't need to send blood all the way to the legs and to the arms. I'm going to keep everything in the core of the body. So it decreases the amount of blood's flowing throughout the body. If your body thinks you need pressure, it'll give you a little dose of epinephrine internally, and then get your blood pressure up and make you more. That's part of your sympathetic nervous system. Sometimes you can get a disease process or a injury to the brain that causes your blood vessels to lose the ability to maintain their structure, and they dilate. If you make the container too big, you drop your blood pressure. So that sometimes you have damage to the spinal cord, or you may have anaphylaxis or an allergic reaction that causes the blood vessels to dilate, and that drops your blood pressure. Simple to fix. You either correct the problem that caused it, or you give them fluids to increase their volume. Problem with the fluids that we typically give, they don't have red blood cells, so they don't increase your blood carrying capacity. They just increase your pressure, which hopefully gets it to all the organs you need. This is kind of what it looks like if you dilate your blood vessel. You've got the normal blood vessel on the left, completely full. You double the size of the pipe, same amount of blood, but you've got half the pressure now. Sometimes we have that permeability issue. When you have a patient that has sepsis, that's a systemic infection, or high altitude illnesses, high altitude pulmonary edema or cerebral edema, it will cause the blood vessels to leak fluids. It leaks into the lungs, it leaks into the brain or the spinal column, uh, it leaks into the interstitial tissue and causes problems for us and decreases the blood pressure. So that's something we need to be aware of. Sepsis is becoming a bigger issue anymore. So a treatment for that one basically is get them to the hospital and give them fluids on the way. Here's what the permeability looks like. Everything's leaking out. If you've ever seen it, it's not the exact same thing, but sometimes you see the person riding the cart at Walmart with the oxygen tubing, and they have huge lower legs, and it'll look like they're sweating, but it's not really sweat. It's blood. It's the fluid leaking out of their tissue. That is from pedal edema or swelling of the lower legs and the blood or the fluids are building up in the tissue and leaking out, but that's the same concept. You've got the fluid leaking out of the bloodstreams into the tissue. Then you'd have that tissue where it's leaking out into the out through the skin. Hypertension. Some people have hypertension chronically. Sometimes it's just an occurrence based on a disease process or a something that's happened in their life. Maybe it's they've got some stress in their life that causes a high blood pressure. Or your body could be really acting to a blockage like a stroke and increasing the pressure to try to push it through. If a person has chronic hypertension, you've increased your risk of stroke and heart disease because it makes everything work harder to maintain those pressures. So it's something if you've got it, you want to get it treated. Then we talked about the loss of control. Sometimes they can't control the blood vessels and they dilate too big. All right, just like we had with the lungs, we have a stroke volume. How much blood is squeezed out each time the heart beats? It's typically 70 milliliters, so not a lot, but it's when you add it up 60 to 100 times a minute, you're pumping quite a bit of blood through the body. So the stroke volume times the rate gives you your minute volume of your heartbeat or your output. Things that they're based on: the amount of blood returning to the heart. If the heart's not filling up adequately, you don't get that uh, expansion, kind of like a balloon. It's pushing out, gives you that increased contractility. And then once you pump it out, there's a little blood left in, and that helps start the process over again. So that's a preload, contractility, and afterload. Stroke volume times a minute beat is your cardiac output. That's how much blood is flowing every minute. The reason we look at this, we're not going to actually calculate this, we can't measure it, but if you know that the heart is beating stronger, it may not need to beat as fast. But it's beating weak, it's going to beat faster to try to compensate. The body's really good, like we talked about, trying to maintain homeostasis. So we want it to go through that process as much as possible and maintain it and keep the body alive. But we need to figure out what's happening and try to fix the problem. So if it's not pumping hard, it's pumping really weak and really fast, we need to figure out how to make it pump harder so we can decrease the workload on the heart. Kids are really good at faking us out. They can increase their heart rate really quick. The body compensates really well and keeps you fooled. So that it's something you need to be aware of. If the kid's heart rate's up, everything else looks normal, be scared. Think the kid might be sick and treat them that way just in case. So problems we're going to run into. Physical problems. You get trauma. You get a hole in the heart. It's a bad thing. The squeezing force, it doesn't, the heart is can't squeeze and expand like normal. And then you have the cell death or the heart attack. You get a blockage in one of the arteries feeding the heart muscle, and it loses the oxygen content, and now the muscle starts to die. You also have electrical problems. Remember, the heart has that automaticity, and we talked about the conductivity system in the heart. Something is messed up in that. Maybe there's a blockage in the conduction system. Or they get some type of external trauma that causes that unorganized religion. A shock, electrical shock, will cause that. A hit to the center of the chest really hard at just the right time will cause your heart to go into those rhythms. So it's important to kind of look at the possible causes, mechanical or electrical, and then see if you can fix that problem. So we put everything together. We've got the whole system here. You got the heart and the lungs working together. If we have problems where they're not working normal, that's called a VQ mismatch. Ventilation versus and perfusion. I don't know why they didn't call it a P, but you got a VQ. It will try to compensate. Again, going back to homeostasis. All right, let's talk about shock. This is what happens when the cardiopulmonary system does not function normal. It is shock. Normal body functions, blood flows round and round, drops off the oxygen and glucose, picks up the byproducts and the uh, carbon dioxide, and perfusion occurs. Hypoperfusion is shock. Something is wrong in that system. Cardiorespiratory, pulmonary, it's not working correctly. So something's messed up. We're going to classify these based on what the cause. The four main categories of shock. Hypovolemia shock means you have low volume. Distributive shock is a low blood pressure because of the tone. That's that one where you lost the ability to contract the blood vessels and maintain a tight container for the blood. Cardiogenic shock is we have something causing the heart not to pump correctly. Could be a heart attack, could be a cardiac arrest. It's just that's the main cause of the shock itself. Then we have obstructive shock. Could be an embolism somewhere in the system, something that keeps the blood from moving, some type of obstruction. Could be a crush injury where we're getting swelling and pushing up against the blood vessels. So you've got your four main: hypovolemic, distributive, cardiogenic, and obstructive. Compensation. Like I keep saying here, the body likes homeostasis, so it's going to try to compensate. It's not really good at compensating enough blood flow to maintain a normal mental status. The most common thing you're going to see on somebody in the very first stages of shock is going to be anxiety. They're anxious, they're nervous, they're excited, not in a good way. That things just aren't normal. So that's your first clue there is shock going on. Increased heart rate. They're trying to maintain that cardiac output volume by changing the heart rate to compensate for a lower blood pressure. They're going to increase their respiratory rate to try to get more oxygen in there for the blood to move around to keep that metabolism going on at the cellular level. It's going to start pulling the blood away from the exterior compartments of your body. You're going to have delayed cap refill. You push on the finger and it takes more than 2 seconds to change it back to pink. It's pulling all the blood away from the skin, so your skin's going to be pale, cool, clammy. They're just going to have that look to them that something's not right. The clammy is the sweaty side. They're dropping epinephrine into their system to try to maintain that blood pressure. And one of the other things epinephrine does for us is make us sweat. So knowing what the signs of compensation are tells you they're trying to hide it from you. They're trying to maintain that homeostasis, but these are the changes you're going to see as they try to do that. Once they get to the point where they can't compensate anymore, they go into decompensated shock. Blood pressure starts to drop, and the vital signs, the mental status starts to change even more drastically. Irreversible shock is when you have cellular death. That can be anywhere in the body, but the most common place you're going to see cellular death on a shock patient is in the kidneys. One of the first things they do to a patient when you bring them in for a major trauma is put a catheter in to check urinary output, and that gives them a look at the kidneys to see how they're functioning. So let's branch out to some pathophysiology of the other systems. The fluid balance. Your body is 60% of water. Of that 60%, 70% of that 60 is intracellular, so it's in the cells. 5% is in the veins or the vascular system, arteries and veins. And then 25 is just kind of hanging out in this interstitial. So it's important to remember those numbers. The 60% of the body is water. And of all the water, 70% is in the cell, 5 is in the vascular system, and 25 is in the tissue. The brain works with us to kind of regulate fluid balance by sending out signals to tell the body how to use the fluid efficiently. The kidneys are that filter of the fluid in the bloods. So they're going to help regulate how much fluid is in there by taking that out. That's where I said you're going to have that catheter put in for traumas to try to figure out if the person needs is having kidney issues with the change in fluid balance. Remember we talked about the plasma proteins in the blood helping maintain the vascular blood content, maintaining that 5% of our fluid in there. The cell membranes, if they get damaged or destroyed, you lose the ability to maintain that fluid balance in the cells. So those are other things that are going to tell the big problems for us as we work through with our patients. One thing what's going to cause a disruption is loss of fluid. You're dehydrated, or you have you lose body fluid by having trauma. You're going to lose the amount of volume in your system. Sometimes we have poor distribution of the fluid. You've seen the people that have congestive heart failure. They have fluid that builds up in the ankles and the lower back, any low places in the body. It's getting out of the vascular system and into the interstitial. They also have problems getting fluid into the lungs. So instead of the fluid staying in the vascular system that's surrounding the alveoli, it's leaking through into the alveoli itself and causing a backup of fluids called pulmonary edema. So that's a disruption of the fluid balance that's causing this problem with the breathing issues. The nervous system, another system within our body that was very important to us. This consists of the brain and the spinal cord. That's your central nervous system. They have bone around almost all the parts there. They're covered with protective layers called meninges, and then they have the CSF, cerebral spinal fluid, around them. Even though they're well protected, we can cause problems to them. So if you have any type of damage to the tissue of the lung, the tissue of the brain, it can start swelling. And because it's a closed system, it puts extra pressure on the inside of the brain instead of just the swelling itself. So we need to be careful and do a good assessment on the central nervous system. So we have motor vehicle crashes, falls, diving accidents. Typical diving accidents are the guys that say, hold my beer, dive into the 2-foot deep pool head first, and just think it's going to impress the ladies, and it really doesn't. So sometimes we have medical dysfunctions. We have strokes. Strokes are a cerebral vascular accident. Either there's a clot that goes up into the brain tissue and has a obstructive stroke or obstructive shock to the brain, or you have a bleed where we have some type of disruption of blood flow because they've got a bleed into the brain tissue. We'll get a lot more detail on those. Then you have the infections, the encephalitis or meningitis, some type of long-term disease like Lou Gehrig's, MS. Uh, those are very debilitating diseases, and it could be as simple as low blood sugar. Remember, the body needs glucose to function. If you don't have enough sugar in your system, your body won't function normal, and your brain's one of the first one to take a hit on that, so you will have altered mental status right away. The endocrine glands, they secrete the hormones that kind of regulate the function of the body. So if we have problems there, we're going to show some basic functions of the bodies aren't going to be normal. Major organs that send out signals for us: the brain, the kidneys, the pancreas, pituitary glands, thyroids, adrenals. These are all sending signals throughout the body to try to regulate homeostasis for us. If they get disrupted, then we have changes in the way the body functions. There could be problems at birth. Some things just don't go right and they don't have the right hormones, such as the insulin. You have a type 1 diabetic. The pancreas isn't producing the insulin, the hormone that's needed to get the glucose into the cells, so we have to put them on artificial insulin. Could have too much hormone, such as Graves' disease, when the thyroid is producing too much thyroid hormone. Leads to problems with the heart rate, problems with weight management, temperature regulation. So typically the only one that we hit a lot of in EMS is the type 2 diabetics. That's more of a problem with the usage of the insulin, not the production of the insulin. And we'll get a lot more detail when we get into the diabetes section here. But if you've got a young person with difficulty maintaining weight or processing glucose, it could be one of those hormone issues with the type 1 diabetes. Adrenal insufficiency, the adrenal glands aren't pushing out the hormones it needs, the cortisol or adrenal aldosterone. They take medication to fix that. When we're having problems, it's usually because they quit taking their meds because they don't like the side effects. Quick, simple solution: get them to the hospital. Alright, your digestive system gets the food, breaks it down, sorts it out, and puts it into the body for use. So major components: the esophagus is a pathway to get it into the stomach. The stomach breaks it down into parts that can actually be absorbed. The intestines do the absorption, and the small intestines and the large intestine does the waste generation, and from there. Dysfunctions, mainly hydration issues for us for EMS. You may see some psychological issues that cause dysfunctions in the digestive system, the anorexia, the bulimias. Then we also have the GI bleedings. If you have, here's a smell you will never forget, and that's a GI bleed. It can be coming out the mouth or the rectum. If they're vomiting bright red blood, it's a fresh bleed. If it's looking like coffee grounds and has a very unique smell to it, it's a chronic bleed such as an ulcer or some type of cancer in the stomach or the esophagus. If they have rectal bleeding and it's bright red or fresh, that's a current bleed. If it's really tarry looking and has a very distinct odor that you'll never forget in your life, that's a chronic bleed somewhere in the system, and it's something they need to get taken care of right away. Vomiting diarrhea is one of those problems that's going to cause us some concern with dehydration. People that are sick, babies in particular, vomiting diarrhea are going to be one of those things that gives us a lot of problems. They're going to be dehydrated, they're going to be malnourished. Need to kind of get a handle on how much and how long it's been going on. One thing the hospital that does like you to bring in is vomit if you can. They like you to contain it in some type of container and bring it into them so they can examine it, kind of get an idea of what's going on with your patients. The immune system, it fights off diseases. White blood cells roam around looking for invaders and attacks them. One thing that we're getting right now, you guys, current topic would be the COVID vaccine. The COVID vaccine goes in there and helps create a system within your red blood cells so that it knows what the COVID foreign body looks like. It knows what the virus looks like. And it gives it a plan on how to fight it when it comes in. Doesn't mean that you're not going to get sick, but it means that it's going to fight it off as best as it can. It's kind of like putting up the wanted poster around town. You know what the disease is before it gets there. When the normal response system to outside agents in the body gets a little bit overreactive, that's the allergic reaction, the hypersensitivity. People have allergies to food, drugs, substances, animals, pets, bugs, plants. People have all kinds of allergic reactions. So we need to be aware of that. That's one of the questions we're going to ask right away. If they're having difficulty breathing, could it be an allergic reaction? And if so, what are you allergic to? Like you get the patient having shortness of breath sitting in Joe's Crab Shack. One of the first questions you might ask, are you allergic to shellfish? When they say yes, but I ate the chicken, point out the name of the business. It's Joe's Crab Shack, which is a fish. So even if we cook chicken, it's going to have exposure to the fish proteins. So very important to identify these and address the symptoms so that we can fix the problems with the patient. Some of the things you're going to see that progress is edema, because it's going to start shifting the blood into the interstitial tissue. It's going to dilate blood vessels and cause the weeping, so then you're going to have the low blood pressure. And people die from allergic reactions. It's real simple to fix. That's the EpiPen, and we're going to learn how to use that, but that's one of those things you need to be aware of. So, as with every other class, if you have questions, write them down, bring them to class, and we'll talk about them. Thanks, and have a great day.